Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a video about or in response to a question that was posted on one of my other video posts. It was a question about if somebody tests positive for a co-infection on a lab but doesn't have any symptoms, should they be treated? So as per usual, nothing I'm saying should be constituted as medical advice, and you should consult with your own healthcare authority before moving ahead with any treatments or whatnot, or investigations into your health. But with that being said, in my practice, if one of my patients was, asymptomatic and they had a testing done and it came up saying they had Bartonella, Babesia, something like that, I would talk to them about their goals. I would talk to them about their exposure history, and just kind of talk to them about what their health history has been like before really being able to answer that question individually for them. Generally speaking, if someone was really healthy and robust, and as has happened in my practice in the past, sometimes very healthy, robust patients do get tested because they're typically a significant other. Sometimes it's another family member, but someone has been suffering from persistent borreliosis or co-infections or things like that, and they say, I just want to get my, spouse or partner or whoever it was tested, just in case there was maybe some transmission between us or something to that effect. And so I have done that testing on healthy folks, like asymptomatic folks on a number of occasions, and sometimes the results do come back showing something. And so the question mark at that point is, are they just an asymptomatic carrier for that microbe? Was it potentially a false positive? Or is it that they actually have some underlying health issues that just haven't really come to the surface, and maybe the microbes are doing some kind of negative activity behind the scenes? And then sometimes there's sort of a mix between a couple of those options where a patient will say, "Oh, I'm feeling really good," but then when I ask the more detailed questions, they say, "Well, yeah, like my joints ache, or I'm more tired than I should be, or yeah, I guess my brain is a bit foggier than it should be." So sometimes there are some underlying symptoms that maybe just weren't really bothering them to the point where they thought they'd ever want to talk to a clinician about it. So it's a bit nuanced in terms of how I would approach that. But if a patient was genuinely not symptomatic, and were feeling good, but they thought, I just want to be on the safe side here and I want to treat for these microbes, I would certainly consider putting them on an herbal regimen to do that, to go after those microbes. I would say to them, you probably won't notice any significant change from this, but you might. I know there are certainly patients or folks who have worked with these protocols, just like worked with, say, an antimicrobial herbal protocol, and they're feeling good, and they feel even better. And so sometimes there might be some background effect from these microbes that the patient just wasn't really aware of, and they do find, like, I'm actually more peppy, my brain seems to be a bit sharper, that type of thing. So I'd have that conversation with them, saying, you might not see any change at all, but you could do a therapeutic trial for, say 4 to 6 weeks, and let's just see how you feel. And there might be some benefit, there might not be. We could retest after the fact, just to make sure that the levels have gone down to normal. And we have done that with a couple of patients before, where they were asymptomatic, tested positive, we treated them, retested, and then their titers or markers were way down or gone. So it's something that is, again, it's individualized, depends on what the goals are of the patient in question. But I think that it's just kind of a nuanced thing. So, or nuanced scenario. So I hope that answered the question. If it didn't, or if there's any follow-up questions to my video response here, feel free to post in the comment section below. And if there are questions about anything else, feel free to post about that too, and I'll try to answer them if I can.